Ben Gonzalez with the Texas Department of Insurance, and this is the Texas Insurance Podcast. On each episode, we look at an insurance topic, why it's important to you, and then offer some tips to help save you some money or protect your property. And today we're going to talk about health insurance, what your options are, and how to shop for that coverage. In a couple of minutes, we'll talk to TDI's Misty Highnote about the special open enrollment period that's going on right now for ACA health plans. But first, we should say there are several ways to get health coverage. You might have access to a group health plan at work or from a union, association, or church you belong to. You can also buy an individual health plan directly from an insurance company or a licensed agent. Depending on your eligibility, you might be able to get coverage from a government program like Medicare or Medicaid. And if you're under 26, you can get on your parents' health plan. And during certain open enrollment times, you can buy an ACA health plan through the Federal Health Insurance Marketplace at healthcare.gov. Now, normally, open enrollment for ACA plans happens in late fall to get ready for the coming new year. But following the COVID pandemic, federal officials created a special open enrollment period for anyone, which runs through August 15th. I spoke with Misty Highnote from TDI's Public Affairs Division about this special open enrollment period and what you need to ask before you choose a plan. Do you need any kind of special documentation to show that you qualify right now?
No, normally during a special enrollment period you do. You need to prove that you either moved, got married, had a baby, lost a job. But since the special enrollment period is for anyone, you don't have to have documentation for any of that. And you can also go online to select a plan. Usually you have to call during a special enrollment period, but right now you can go online to healthcare.gov. There's still the call option if you want that too.
So it really is kind of an open enrollment again. And you mentioned people that may have lost a job or may have had their hours cut back severely. We know the service industry is hit very hard right now. Is there help to pay for this coverage if they need it?
There sure is. There's still the subsidies that you would normally get during the open enrollment period. You can see if you apply for those, that'll help you with the coverage. And that's a benefit of buying a plan through healthcare.gov instead of just calling up an insurance company directly, is that you can get those subsidies if you go through healthcare.gov. And if you already have a marketplace plan and your income has changed or you've lost a job, then you can go to your profile on healthcare.gov and see if you qualify for a higher subsidy. That might give you some more help.
That's always a good idea if your income changes at all. But this is kind of a redo period. Like you said, you can also change plans now, which is really unique. So normally during open enrollment, plans always start at the beginning of the year. How are they going to do it for this kind of special enrollment period?
Right. Important question. You want to know when your coverage starts.
Mm-hmm.
Right. So after you get all your paperwork done, you've chosen your plan. The month after that, on the first of the month, that's when your coverage is going to start.
So with all those different kinds of choices out there, how do I know I'm getting the right thing for me or me and my family?
Right. And you definitely want to ask questions of yourself. So you want to know your doctors, your medicines, because when you're looking at a plan, you want it to be able to pay for the doctors you see, the medicine you use. So when you're looking at the plans, the agents and companies should be able to tell you what doctors are in their networks, if they have a network, or if they don't. You want to ask that too. So if you have some medical conditions and you see a certain specialist or a certain doctor, you don't want to change plans and then not be able to see those. So you want to ask about your doctors, you want to ask about your medicine. If you have certain medicines that you take and you really need those medicines still, of course, you're going to want to ask if the plan covers those medicines. So there's just some questions you need to ask for yourself and your family.
So you start off by asking yourself what's important to you, and then you can ask others if that's what's in their plan.
Right.
So I guess one of the big things, of course, for a lot of us is how much is this going to cost me? And so on that front, is there, I guess it depends on what you choose, right?
Right, exactly. Yeah, there's a wide array of costs. So when you start shopping around, if you go to the website or if you get a quote, you're probably going to see that one premium amount. And that's probably the first thing that's going to catch your eye. And that is important because that's what you're going to be paying every month for that plan. But you also need to know that there's other costs that go into that plan. So when you go to the doctor, there's going to be a copay probably. You want to know what that amount is. There might be a deductible. That's the amount you have to pay before your company starts paying. So that's important. And then there's co-insurance. That's the amount you have to pay if you get a procedure, you go to the hospital, you have to pay a certain amount of your care. So you just want to really know, other than a premium, what are costs that are coming out of my pocket? And then you'll also be able to tell if you have a low premium, a high deductible, low premium. Just know that there's probably some give and take there. If you see a low premium, look at that deductible because there's a good chance that's going to be high. And that might be fine for you if that's the choice you want to make to save on premiums and have a high deductible. Talk to your agent, talk to your company. If that's the choice you want to make, great. But just be aware of the cost.
Yeah, and I guess ultimately the lowest cost stuff is probably going to have cover less, and there may be some limits to it as well. So whenever a lot of people are looking for a product, there's going to be somebody that wants to try to take advantage of it. So what can we do to avoid any scams that are out there?
Right. So one of the biggies is an agent or a company that can't answer your question. If these agents and companies are selling plans, they should know inside and out how their plan works, what it costs, what it covers, and you should be able to ask that of any agent and company. So if they don't know that, that's a big red flag. You also want to look out if an agent or company says limited time offer. You should be able to take all the time you need to decide, to compare, to ask questions. So don't let anyone rush you. And those are all big warning signs that maybe you want to try a different company. There's a lot of companies out there, so don't feel pressured to use one or another. Those might be some signs to start looking elsewhere. And you also want to
move on to the next one on your list.
Right, move on down the road. Yeah. You also want to watch out if you're looking for an Affordable Care Act plan. You want to make sure that's one you're getting. Those ACA plans have benefits that are required by law. So if that's the plan you want, great. But you want to make sure that's the plan you're paying for. So watch out if you see plans that say bronze, gold, silver. Make sure those are ACA plans because a lot of companies might use that marketing and it might not be an ACA plan. And then finally, you want to watch out for callers. If you get a call and it might come in from a certain company, you might look at your phone and say, oh, that's the company that I'm buying from. But they're also able to spoof phone numbers. So even though that's the company coming in, that might not be the company that you want to talk to. So maybe, pick up the phone and ask the person, what's your name, and then call them back on the number that you have. So watch out for those numbers too. Yeah. So just got to be careful.
You can't even trust caller ID anymore. Well, that's a lot of stuff to keep track of.
Yes, it is. It is. On our website, that's a good place to start. On our TDI website, we have a great shopping guide. So we try to condense it to one page and have some of the major questions, some of the stuff I went over today and more. So just things to keep in your mind and to ask your agent or company. So check out our website for that shopping guide for sure.
So just type in Health Plan Shopping Guide in the search box on TDI's homepage, and that'll get you that list of questions to ask before deciding on a health plan for you and your family. Well, that's it for today. We have more information about health insurance on our website, tdi.texas.gov, and you can also call our helpline at 800-252-3439 to ask your insurance questions. And remember, subscribe to the Texas Insurance Podcast, wherever you get your podcasts, so you don't miss out on this important information. We'll talk to you next time.